The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LA News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rushed office visits, both you and I can discuss your healthcare needs. If you wait, it may be late. To my military family, I got your six. To my Masonic brothers, the light is bright. Please welcome my co-host, Sammy Vanny.
How are you, Dr. O'Brien?
All right, how are you?
I'm good.
Everything good?
Yeah, everything's good. Had classes today. A little tired, but we're okay.
All right, so how's school going?
It's going good. I had a presentation today, so that took a lot out of me.
All right, what was the presentation on?
We had to interview people or anyone that we wanted in like a job that we were looking for or something we were interested in. I did my cousin, who's a hairstylist, but I don't want to be a hairstylist, but she owns her own company, so I thought that was pretty cool to do. Right. She's a female business owner, and I thought that would be really nice to share with my classmates.
Mm-hmm. Okay, good. Well, one day maybe you'll be a business owner.
I hope so.
There you go. All right, so let's talk about today's show. We're talking about the skeletal system. The skeletal system, or the muscle skeletal system. All right.
All right, so for the next month, we're giving away 50 vouchers for a full body adjustment, including a detailed physical and spinal examination, along with a personalized adjustment treatment plan, all for just $49, normally a $250 total value. This is a limited time offer as we've had a lot of interest, so we encourage you to call the office today and schedule your appointment. We look forward to serving you.
All right, thank you for that. That's a public service announcement. Well, besides that, I offer provide care for patients that are involved in a motor vehicle accident. So not all physicians and not all practices and urgent care centers accept patients that are involved in a motor vehicle accident. I accept patients. So if you're involved in a motor vehicle accident, you injured your neck or your back, or if you have chronic neck or back pain, just give my practice a call. I'm accepting patients. Again, this is a concierge type of practice with no fault. I do accept no fault insurance, and what no fault insurance is that is car insurance when you're involved in a car accident. I do accept that, but the rest is concierge. We're giving quality care, all right? So it's no rush office visits, so both you and I can develop a physician-patient relationship, a true relationship, not one of those 5-minute one complaint and you're out the door. That's not how I work my practice. You know that, right?
Oh, I know that very well.
Exactly.
I come into your office and now we're doing a show together.
Yeah, that's right. That's right. You come in as a patient, now you're here with me. Well, that's it. Talking about if that's what a true family practice is. I embrace my patients and they become part of my family. It's important because if you know your patients, you know what their baseline is, and then you could see the changes and then make adjustments so we can improve ourselves, and that's what it's about. It's more than, prescribing a pill. Anyone can prescribe a pill, but And I keep saying that. I say that all the time because it's the relationship. You really have to look, listen, and feel. That's what family medicine is. And that's what really medicine in general is really about. Now it's just get them in, get them out.
If you need a doctor, go to Dr. O'Brien. I highly recommend him. He makes you feel comfortable and always welcome.
My door's always open. All right, we're talking about today's show is the musculoskeletal system or the skeletal system. And you know what the musculoskeletal system is? During Halloween, you see all the skeletons that come out. And that's what we're talking about.
All right, so the first question we have is, what is the skeletal system?
Yes, the skeletal system works as a support structure for your body, right? I always say structure is function. Without proper structure, there is no function, or what we call dysfunction, and that came from Dr. A.T. Still, our founding father. It gives the body its shape, allows movement, makes blood cells, provides protection for organs, and stores minerals.
Okay, what is the skeletal system?
All right. So the skeletal system is your body's central framework. All right. It consists of bones and connective tissue, including cartilage, tendons, and ligaments.
I feel like I'm back in my nursing classes. I'm getting PTSD.
Well, just imagine when we took anatomy.
Oh my God.
Yeah, anatomy. Oh boy, this was the screening class. One of the screening classes is the first class in medical school, and so we start with one half of the body, and the second half it's going to be the opposite side. And if you're not able to pass anatomy, you're not making it to medical
first
school.
Class is anatomy and physiology, along with chemistry. Couldn't do it.
Well, same thing with DPM, because in my medical school was a university, so we had podiatry as well and a few other programs. And we said if you didn't pass lower limb in anatomy, that's it. You're done. You're not in the program.
For you then.
Yeah,
if you can't understand that, then it just gets more complex from there.
Yeah, absolutely. I remember, we were dissecting out, and everyone looked at the body, because remember, this is a family that donated their family to the medical school. So we have a ceremony, and and at the very end, we have a funeral, and we thank the family. Right, we all write letters and sign cards. It's so important because they're donating their family member to science. And the first day, you have to dissect out. And I said, okay, I'll try it. I'm just going a little bit with the blade. And our mentor's like, no, you got to get in there. So, like, oh no, this is a person. No, come on, you can cut. Go, come on. I'm like, oh man,
I can't even watch it on TV. They would want me to do that. Nope, I can't do it.
All right. So, I said, what does the skeletal system do? All right. The skeletal system has many functions. Besides giving us, our humans, the shape and features, it allows us movement, okay, right? Like last week, we spoke about the discs, okay, and what the function of the disc were, and that was a cushion in between the bones.
Jelly donut.
Right, the jelly-filled donut. That's right, exactly. Well, this is part of it, okay? So you're talking about it supports our body weight, so we can stand, we can move, and allows the joints and connective tissues works together, so your body's able to expand, what we call flexion, extension, okay? And there's all different movements. We have a three-dimensional plane. We're able to move in all those planes of motion. And this is what the musculoskeletal system allows us to do, or in this case, the skeletal system. It also produces blood cells. That's right. And you're like, well, how does the bone produces blood cells? Well, that's in the matrix, okay, in the center of the bone, where we call the bone marrow. And the bone marrow produces, there's hormones that are sent from the kidneys, and the kidneys, that hormone goes to the bone marrow, and the bone marrow starts to produce our red and white blood cells. It also protects and supports organs, okay? Protects and supports organs. Our skull, all right? What does our skull do? Well, it protects the brain, So you get in a car accident, well, you wear a helmet. Well, still, you have your skull as well. The brain is just jelly, It's very, very soft tissue, so the skull protects it. We have the rib cage, right? What is the rib cage for? Well, the rib cage will protect the organs that are in the thorax, and that would be your heart, your lungs, your kidneys. We try to get underneath, it's illegal for kidney shots because you'll drop someone. That's why I have kidneys. The ribs to protect the kidneys and so forth. All right, we have about a minute and a half left, and then we'll move on. It stores minerals, okay? Well, the bone minerals. That is why when someone's starting to break down, and we do like DEXA scans, and they're saying, they're getting shorter, they're starting to thin out. We look at their diet, their hair is, getting very frail. Their teeth, we look at their teeth, and we're seeing things starting to break down. We look at the bone, we're saying, oh boy, what's happening there? The bone produces, and stores, not produces, but it stores minerals such as calcium and vitamin D. And that's why for good bone health, we always talk about vitamin D and calcium supplements. All right, so we're down to the last 30 seconds. Anything I can say?
I don't know. I'm learning a lot.
You learning a lot?
Yeah.
How's mom?
She's good. She's not bad.
Not bad?
She's working hard.
All right. How's sis?
She's good. She's still a pain, but she's good.
She getting ready for her prom?
Prom, graduation, college. I can't wait till she goes away.
There you go. All right. So to learn more about my practice, you can go to drtomio.com. That's drtomio.com. Or you can give my office a call. It's 631-980-8200. 631-980-8200. Come on by, say hi, and learn about Dr. Tommy O. Welcome back to the X at Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The X Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LA News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. So we're starting part 2. Welcome back. Sammy, welcome.
We're back. Did everybody miss us?
Yeah, we're back. Oh, you know what? I got to mention something. Okay, I want to wish my my wife a happy anniversary 2 weeks later.
Are you still in trouble for that?
No, I'm still in the doghouse. It's worse because I haven't been feeling well. I've been keeping her up at night because I've been coughing.
That's definitely getting her.
Yeah, no, she's not happy. All right, so we're talking about the musculoskeletal, or specifically the skeletal system. So let's continue.
Alrighty, so the next question we have are, what are bones and what are their functions?
Yes, okay. Well, there are approximately 206 bones. Actually, when we're born, we have more than 206 bones. And you're like, well, how you're born with more bones? And yeah, when you're an adult, we end up with 206. Well, what happens? Well, some of the bones, they fuse, okay? They fuse, and so we have fewer bones. All right, so each bone has three layers. Okay, just think of 3 layers. All right, so we're gonna go back to that jelly-filled donut, and no.
I'm thinking of a rainbow cookie right now.
Yeah, there you go.
Those different layers on it. Now you got me hungry.
No, one of those swirl cakes. That's it. A swirl cake. All right. So the first is the periosteum. The periosteum is a tough membrane that covers and protects the outside of the bone. All right. So everyone knows what this is, right? If you were chewing on ribs, right? Okay. As soon as you get down past the meat and you're right on top of the bone, you see that film that's across. That's what we're talking about right there. Okay. So then we have what's called compact bone. All right. Below the periosteum, compact bone, which is the white, hard, and smooth structure. Okay. That's what we see when you see a skeleton, during Halloween. That structure, that is the compact bone. It's real tough. It's strong. It provides structural support and protection, right? When we say structure is function, there it is right there. Strong, okay? Then we have the spongy bone, and this is the core. It's the inner layer of the bone. It's softer than compact bone and has small holes called pores, okay? That's within the center there, and that's where the red blood cells and the white blood cells are being produced. All right. Now, some people when they eat meat, they'll dig into the center of the bone. They'll literally eat that. I don't eat that, but they will eat that because I find that delicious. That's what I'm talking about. All right. There are other components of the musculoskeletal system, and that includes cartilage. This is a smooth, flexible substance that covers the tips of your bones or where they meet. It enables the bone to move without friction, right? Well, we have cartilage at the tip of your nose, all right? Also your ears, your earlobes. This is, cartilage. You have to be very careful. If you damage cartilage, it doesn't have really a lot of blood flow. That's why when you pierce your ears, pierce your nose, it really doesn't bleed. So if you damage it, the healing process, it's difficult. You have to go in and see a cosmetic surgeon so they can repair that. And it's still difficult because some surgeons won't take on the case because it might not heal well because of the decreased blood flow. All right, joints. A joint, this is where two or more bones in the body come together. There are three different joint types. The types of joints are as follows. And the first one I don't necessarily agree with, and I'll explain that. It's immovable joints, and immovable joints don't let the bones move, right? Based on the name, like joints between your skull bone. Okay, now I'm an osteopath, same thing with a chiropractor. We both believe in craniopathy, okay? I don't necessarily practice craniopathy, but we have the sutures in the skull. And I'm not talking about sewing together. We call them sutures, and that's the grooves where the two bones meet. Here, if you read this, it's saying that they do not move. Yes, they do move because actually you can move the cranium. I can put your head in a vice. Now, there's a movie out there where they put a guy on the table and he had his head in his vice, and they started tightening up the vice. And then his cranium started to shift. Well, that's it right there. So it does move. Okay. And we did have a doctor do that on himself, and he was able to displace the bones by using a vice on his head because he was experimenting. He was able to move the bones. Okay. The second would be partially movable joints. These joints allow limited movement. The joints in your rib cage are partially movable joints, okay? Because you don't want a lot of movement, because then we start to change the structure. Structure is function, and without proper structure, there is no function, or rather dysfunction. So we want to be able to have controlled or minimum movement in those areas. Then we have movable joints. Movable joints allow a wide range of motion. Your elbows, your shoulders, your knees are movable joints. That's why you have that really large range of motion, okay? Axial skeletal system. Then we have the ligaments, and these are bands of strong connective tissue that holds the bones together. Ligaments, okay? So, ligaments, very important. These are always test questions, right, on the boards, okay? Ligaments and tendons, which will be next. So, how do you remember the difference? Okay, ligament is bone to bone. Tendons are bands of connective tissue that connects the ends of the muscle to the bone. And so for me, how did I remember that? Well, the M train. M represents muscle. The train represents T, which is the tendon. So M train, that's how I remember this, because we were asked these two questions. And you can easily confuse ligament and tendon, especially when you're first learning. So I had to come up with a mnemonic. So M train, you ride the M train. Of course, here in New York, we have an M train, okay? So, so tendons were muscle to bone, and ligaments are bone to bone.
I should have had you during my classes. You could have helped me.
Well, it's all, you know what? How do you learn? You have to come up with mnemonics. Now, I had, everyone wanted my notes because what I had in my margins, I had all dirty mnemonics, all silly little dirty jokes, and that's how I remember this stuff. But I have, things I can't say on the air, but, things that I still remembered, from almost, like 32 years ago.
Those are the things you'll never forget.
Yeah, no. Well, that's what got me through, and here I am today.
All right. How do we keep our skeletal system healthy?
First, you got to take the initiative, okay? You have to want to, okay? If you come to me and you're not actively participating, I can't. It's you. You have to be a part of the healing process or being healthy itself. So you have to be proactive. What do we say? Have a thorough history and physical, and you have baseline blood work, okay? Then, depending on your needs, if you need vitamin D, of course we do a vitamin D level, then we're going to do vitamin D. We'll look at your calcium. We can also do a DEXA scan, right? We can look at your calcium score. We can look at, how many deviations to the right or to the left, and that will determine if you have normal or osteopenia or osteoporosis, depending on what we need. And then that's how we treat it. Okay, you can have a vitamin D plus calcium and supplement. You want to make sure you drink plenty of water, and this keeps the tissues nice and healthy and hydrated. We want to keep hydrated. Remember, with the degenerative disc disease, we were talking about dehydration, okay? We want to make sure we're well hydrated. You want to exercise regularly to strengthen the bones. Now, Very important, okay? It's not just exercise. It is weight-bearing exercise, right? When both you and I go to the gym, you're working out, right? You're pushing weight, okay? There's resistance. We need that resistance. It's called weight bearing. Now, if you're going to go out for a run, yeah, that's great. It's good for your heart, cardiopulmonary system, but not the muscle skeletal because it's not weight bearing. So you want weight bearing. Same thing with swimming. Excellent cardiopulmonary, but it's not weight bearing. So we need weight bearing. And that's where you go in. You're going to push the weights a couple times a week. So we're pushing back. The bone responds to pressure and it thickens up. You want to stay at a healthy weight. You want to, remember ideal body weight. I just addressed ideal body weight, overweight, okay? And then we had obesity, 10%, 20%, and 100% over ideal body weight. Let's stay as close to ideal body weight as possible. And you want to wear protective gear, especially during contact sports. You got to watch your lifestyle. If you're going to be, take high risks, then you have to protect yourself. All right, so we're down to 25 seconds.
Alrighty, so for the next month, we're giving away 50 vouchers for a full body adjustment, including a detailed physical and spinal examination, along with a personalized adjustment treatment plan, all for just $49, normally a $250 total value. It's a limited time offer and we have a lot of interest, so we encourage you to call the office today and schedule your appointment. We look forward to serving you.
That's drtommyo.com, drtommyo.com.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.